Thank you, Dr. Sariga and Dr. Samarchakar, and those who attend the Hindi session. Good evening, good afternoon, and good morning. This is the 1970th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. NAMRATA TRIVEDI. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with anyone who loves homeopathy. The purpose of this forum is to take homeopathy to every home around the world. And as you all know, just 30 days to go for a 2000-day celebration. We are planning to conduct such celebration in the Zoom itself this time. Hope all of you will be participate, and you can also contribute some of your experiences during the session. And let me come to today's guest, as it is none other than Dr. NAMRATA TRIVEDI. She has completed MD and now working as Assistant Professor, Department of Anatomy, Ella Shah Homeopathic Medical College, Rajkot, Rajkot, Gujarat. And she is the consultant physician at Trivedi's Homeopathic Clinic, Rajkot. And she has done different clinical experience. She has got 5 years of clinical experience in different working in different part, particularly in work as a medical officer in civil hospital, Rajkot during COVID time, and medical officer at Rajkot Cancer Society and Ahmedabad Homeopathic Medical College. And we have an excellent session coming on that is on irregular menstruation, a holistic homeopathic perspective. As we all know, this is one of the troublesome subject for for most of the ladies, because they used to have menses every time, but all of a sudden, sometimes it may stop, and sometimes it may happen every 2 weeks, or some 4 weeks, or 3 weeks, and sometimes it may not stop, and it may continue for and it may restart again, with even without such cases. How we homeopath can manage? So how we can manage? That is what Dr. Namrata Trivedi is about to explain. That's the reason why she is giving the subject name as holistic homeopathic perspective. So we proudly welcome our guest of the day, Dr. Namrata Trivedi, to this session. Welcome, Doctor. An young dynamic personality.
Thank
She
you
has,
so much, sir,
yes,
for
yes,
this beautiful introduction. Uh,
yes.
yes,
We need such kind of dynamic personalities for promoting homeopathy.
yes, yes.
She has done a presentation in Hindi some weeks back, I think. Am I right?
Yes, sir.
Yes,
Yes, sir. Yes, yes, sir. Uh,
you can share.
sir.
Yes, you are
Yes,
the
sir.
co-host. You can share it now. Let me check once again. Yes,
Sir.
you are the co-host. You can share. Just click on the share button.
Okay, sir.
Oh, okay, it is coming. Opposite. Last page is here now. That is
Yes, sir.
unfortunately the last page.
Okay.
Okay,
Thank you so much, sir.
you can make
Myself.
it a large screen, big screen.
Okay, sir.
Just click on the top. Okay, doing fine.
Myself, Dr. Namrata Trivedi, from LRSA Homeopathy College and consultant physician at Trivedi's Homeopathy Clinic, Rajkot. Today, my topic is irregular menstruation with a holistic homeopathic approach. homeopathic perspective. Today we will discuss about the different causes of irregular menses with its treatment, homeopathic and allopathic, and what is the investigation we should do. First, what is the definition of menstruation? It is the periodical and cycling shedding of endometrium experienced by the every woman of reproductive age group. There is a pieces of blood are passed through the cervical canal and through the vagina. Now, uh, what is the definition of irregular menses? Irregular menses is not just mean there is a early or late menses, but there is a deviation from the normal menstrual cycle. In the terms of there is a any deviation from the frequency, duration, amount of blood loss, or any regularity. Means irregular menses, it's not just mean there is a early menses or late menses, but it's about the what duration of menses, frequency of menses, what amount of blood loss, and regularity of menses. Okay. Now, the normal menstrual cycle is a normal length of cycle is 28 plus or minus 7 days. Duration is about 2 to 7 days. Normal blood loss is about to 5 to 80 ml. Average blood loss is about the 30 ml. Regular ovulatory cycle. Now, now we can see the classification of menstrual disorder. Means, uh, in under the heading of irregular menses, there is a many different terminology are there. First one is the amenorrhea. Amenorrhea means there is an absence of menses in the female of reproductive age group. Second one is the oligomenorrhea. Oligomenorrhea means there is a lengthened duration, lengthened duration of menstrual cycle. Means there is a menses appears after the 35 days. Polymenorrhea means there is a duration of menses is shortened less than the 24 days. Next one is the menorrhagia. Menorrhagia means there is a heavy and prolonged menses. Next, metrorrhagia. Metrorrhagia means there is a acyclic bleeding. Means there is a irregular menses. Maybe menses may be the early or late, but blood flow is maybe the normal or maybe the heavy. Next one is the hypomenorrhea. Hypomenorrhea means there is a scanty blood loss during menses. Next, dysfunctional uterine bleeding. It means there is a increased frequency, duration of menses. It may be due to the hormonal imbalance. These are the different terminology. We can include it in the menstrual irregular menses. Okay. Now we will see the different etiology, different causes of irregular menses. First one is the physiological cause. Second one is the endocrine cause. Third one is the structural, systemic illness. Iatrogenic cause means cause related to drug. Next is the pregnancy related cause. Okay. Now the physiological cause. In the physiological cause, first one is the puberty. During the early time of puberty, after the menarche, irregular menses is most commonly due to the hormonal imbalance. And before the menarche, there is a physiological amenorrhea. Next is a pale menopause. Before the menopause, there is a many hormonal imbalances, many hormonal changes. So before the menopause time, there is a irregular menses. During the lactation, there is a physiological amenorrhea. Next, stress. Stress is a most common causative factor in uh, during these periods, during this era. Next, weight changes. If there is a significant weight gain or weight loss, approximately 5 to 10% of the body weight. If there is a 5 to 10% body weight loss or body weight gain, both can cause irregular menses. Okay. Now the endocrinal causes. First one is the PCOS. PCOS is the most common disease in today's era. PCOS means there is a multiple cyst in the ovaries. It can cause irregular hormonal imbalance and it can cause the irregular menses. Second one is the thyroid disorder. It includes both hyperthyroidism as well as the hypothyroidism. In the cases of hyperthyroidism, there is a Oligomenorrhea means there is a lengthened duration of menstrual cycle. With the hypomenorrhea means there is a scanty menses. But in the cases of hypothyroidism, there is an exact opposite. There is a polymenorrhea with menorrhagia. Okay. Now the hyperprolactinemia. Hyperprolactinemia means there is a abnormal increased level of prolactin hormone. Increased abnormal level of prolactin hormone can cause an ovulatory cycle. Means there is a menstrual cycle is normal, but there is a no ovulation during the menses. Okay. Now the adrenal disorder. Many causes like many diseases of the adrenal gland like a congenital adrenal hyperplasia or Cushing syndrome. It may also cause the irregular menses like a menorrhagia, hypomenorrhea or metrorrhagia. Means uh, any disease related to adrenal gland, it can also causes the irregular menses. Now the diabetes. Diabetes and PCOS has a direct relation. In the female of diabetes, in the cases of diabetes, uh, we can also see in the irregular menses. Okay. Now the structural causes. First one is the fiber uterus. In cases of uterine fiber, there is a menorrhagia, metrorrhagia with oligomenorrhea. In cases of endometrial polyp means there is a benign tumor growth inside the uterine wall. It also causes metrorrhagia with menorrhagia. Next one is the adenomyosis. Adenomyosis means there is a tissue similar to endometrium which grows in the muscular wall of the uterus. Adenomyosis it also causes dysmenorrhea with menorrhagia and metrorrhagia. Next one is the endometrial hyperplasia. Endometrial hyperplasia means there is an abnormal thickening of the endometrial wall in under the stimulation of the estrogen. There is an absence of progesterone. Means endometrial wall is thickening due to the constant estrogen stimulation to the endometrium. But there is a no progesterone, absence of progesterone hormone. In the cases of endometrial hyperplasia, one can also see the irregular menses with menorrhagia and polymenorrhea. Now the malignancy. In the cases of cancer of uterus, one can also see the irregular menses. Okay. Now the systematic and drug causes. First one is the coagulant disorder. Some coagulant disorder like von Willebrand disease. In the von Willebrand disease, there is a one factor, coagulating factor, von Willebrand factor. This factor is functionally abnormal or there is a decreased function of von Willebrand factor. It causes the uh, it causes the improper clotting. Von Willebrand factor is one of the clotting factor of the our blood in our blood. So, if there is any improper function of the von Willebrand disease, von Willebrand factor, there is a menorrhagia with excessive blood loss during the menses. Next one is the liver disease. In the liver, the estrogen is breakdown in the liver. So, if any damage to the liver, it can also causes the hormonal imbalance and irregular menses. Next one is the renal disease. In the cases of chronic kidney disease, there is anemia because of the erythropoietin is secretion from the kidney, and erythropoietin is responsible for the formation of the RBC. So, in the cases of CKD, chronic kidney disease, one can also see the anemia and irregular menses has a direct relation. Okay. Now the anticoagulant. Many patients are on the anticoagulant medicine. Who medicines? She is also experienced menorrhagia with heavy menstrual bleeding because uh, patient who are patient who are taking anticoagulant medicine there is a uh, uh, increased clotting time. Due to the increased clotting time, there is a menorrhagia with metrorrhagia and heavy blood loss during the menstruation. Now the hormonal drugs. Many hormonal drugs like OCPs or many hormonal drugs like OCPs or progesterone therapy, it can also causes the irregular menses. Okay. Now the clinical evaluation. How physician can approach in the cases of irregular menses. Okay. First one, physician has to take detailed menstrual history. Okay. In the detailed menstrual history, a physician has to ask about her menarche at the age of menarche. What age he has her first menstruation. Next, he has to investigate about the duration of menstrual cycle, frequency of menstrual cycle, how much blood lost during the menstruation. Okay. Next, one has to take obstetric history. In the obstetric history, physician has to ask about the multigravity or nulliparity. Other means there is a number of live birth, number of dead birth, or there is any complication during the labor, have any complication during the pregnancy, or any abortion are there or not. Obstetric history and menstrual history is most important in the cases of irregular menses. Now the drug history. Physician has to take on the drug history. A physician has to evaluate whether patient taken any drug which can causes irregular menses or not. Now the general examination. Okay. Physician has to general examination of the patient, like he has to check his nails, his skin, his eyes for the evaluation of the anemia are present or not. Because of the anemia, there is irregular menses. Next, physician has to take on his BP, respiratory rate, respiration rate, pulse rate with examination of the thyroid gland. Uh, we earlier discussed that thyroid disorder can also causes the irregular menses. So, physician has to examine his thyroid gland, has to take his BP with respiratory rate, pulse rate, has to examination of the nails, examination of the skin, with the examination of the sclera for the checking of anemia is there or not. Okay. Now the investigation. What type of investigation physician has to do in the cases of irregular menses? First one is the pregnancy test. Physician has to do pregnancy test for the evaluation of for the knowing if pregnancy is there or not. Second one is the CBC. Next is the thyroid profile, serum prolactin, ultrasound of the pelvis, endometrial biopsy if there is any suspicious case of cancer. Okay. Next, the management. How to physician has to manage the cases of irregular menses in cases of allopathy. Okay. First, physician has to treat underlying causes like if patient is taking any drug which causes irregular menses, physician has to stop this drug or alternative option has to find out alternative option for this drug. If there is any anemia, he has to correct anemia. If there is any kidney disease, liver disease, or adrenal disease, he has to treat this disease with with symptomatic treatment. Next one is the medical management preferred initially. First, we have to treat the patient with the medicines. If there is any cases of fibroid uterus, endometrial polyp, or there is any cases of cancer, in which there is a absolute indication of surgery, physician has to refer to the surgery if there is any absolute indication of the surgical management in the cases of irregular menses. Okay. Medical management. Antifibrinolytic drugs like tranexamic acid. Many physicians give the tranexamic acid in cases of there is a menorrhagia, heavy blood flow, heavy blood loss during the menses. Combined oral contraceptive pills. Physician can give the combined oral contraceptive pills in the cases there is a hormonal imbalance, there is a estrogen progesterone imbalance. Next, he has also can take can can give the progesterone therapy for the irregular menses. Okay. Now then now I will discuss few homeopathic medicines in the cases of irregular menses. First one is the pulsatilla. In the cases of pulsatilla, there is amenorrhea, means absence of menses, which suppress menses from getting feet wet, nervous stability, or chloros. We can compare pulsatilla medicine with the Simicifuga, Senseo, and Polygon. With the Simicifuga, pulsatilla has a late and scanty, thick, dark menses. But in the cases of Simicifuga, there is a profuse menses with dark red flow of the blood. In the cases of Senecio, in the cases of pulsatilla, there is a irregular menses since puberty. But in the cases of Senecio, there is a irregular menses amenorrhea with the kidney disease. Okay. In the cases of polygon, there is a profuse bleeding day and night. But in the cases of pulsatilla, there is a thin, scanty menses and menses flow stop at the night. Now, tardy menses means profuse, prolonged menses with too late, scanty, and thick, dark clotted blood. There is a changeable menses. One day there is a dark menses, another day there is a bright menses, intermittent flow of menses, menses with there is a chilliness, with nausea and downward pressure, with painful menses. These phenomena are there. Flow are intermittent, nucleoli is acrid, burning, and creamy. There is a pain in the back region with the tired feeling and maybe the diarrhea during or after the menses. Patient has a better in the open air and there is a secretion of milk during the menstruation. Okay. What is the causes behind the irregular menses? In the cases of pulsatilla, one element from there is a immature ovaries. Second one is there is a hormonal imbalance. Uh, we all know there is a that Pulsatilla is very mild, very gentle, and emotional. Emotional. Uh, Pulsatilla is indecisive means uh, there is lots of hormonal imbalances in cases of Pulsatilla due to he is very yielding disposition and he is very mild and gentle. Elements from homesickness, elements from cold air, and damp exposure. Now the sepia. Sepia. Menses is too late and scanty with irregular menses early and profuse with sharp clutching pains. Sharp clutching pains means there is a pain which is like a contraction and relaxation pain like a throbbing pain and pains like a something is clutching, something is pressure from inside. Violent stitches upward in the vagina from uterus to the umbilicus region. Leukorrhea is yellow, greenish, milky in large lumps, especially in the little girls, the girls of the puberty age. There is a leukorrhea instead of menses. Metrorrhagia at the time of menopause. Sudden flashes of heat with weakness and sweat during the menopause. Ailments from Pulsatilla has ailments from repeated childbirth, overwork, long-standing uterine congestion, from the liver dysfunction, and from the indifference to family. Okay. Now the calcula calf. Calcula calf medicine has a early, profuse, and delay menses. If there is a menses is too early in the girls, means there is a menses is too early in the cases of girls having a puberty age. Menses is too profuse, too long with a vertigo, with a toothache, and menses with cold, damp feet. There is a leukolia is thick, milky, gushing, or yellowish, and leukolia is worse during the urination, and leukolia with there is a itching and burning in the vagina. There is a tender and swollen breast before the menses. Patient is very obese and cold intolerance means patient is chilly and profuse sweating. Menses late in the cases of fat and flabby girls, menses with palpitation, dyspnea and headache. There is an absence of menses in the cases of plethoric woman, obese woman. Menses is absence, amenorrhea from the fright. During pregnancy, female is clumsy, awkward, and very tired. Before menses, there is a headache, there is a colicky pain in the abdomen, there is a chilliness and leukorrhea. There is a cutting pain in uterus during the menstruation. Now the ailments form. We all know there is a slow physical growth in the cases of calcula calf. So one ailment form is the slow physical growth, late sexual maturity with poor nutrition and anemia can also causes the irregular menses or amenorrhea in cases of calcula calf. Next is the thyroid. The calcula calf is the main action on the gland and in the tonsils. So if any woman having a thyroid, we can also think about the calcula carb and obesity, ailments from obesity. Okay. And now the nectar muliaticum. In the cases of nectar muliaticum, there is a delayed first menses with a debilitating leukorrhea. Leukorrhea is white, heat in character and leukorrhea instead of the menses. Menses is very scanty, irregular or suppressed and there is a anemia and headache with the menses. Patient is very reserved, cannot do not share with anyone. There is a very suppression of all the emotions. Either is a grief or anger. All the emotions are suppressed. Patient is grief bearing personality and very reserved. And in cases of suppressed menses, we can give the Kalikap follow the netramune. Okay. If there is any patient, any female who has a previous grief or sorrow or suppressed emotions, and after that, if she develop amenorrhea or irregular menses, we can give her the netramule medicine. But after given netramule medicine, if there is a mental disturbances are all okay after given netramule, but there is absence of menses after absence still there is a no menses after given netramule. We can give kali carb medicine. Okay. A patient is hot during menses. Okay. Now the ailments from. Patient has ailments from after the silent grief, suppressed emotion, disappointed love, anemia, if any exposure to sun, and can also causes amenorrhea and irregular menses in cases of netramuliaticum. There is any hormonal imbalance during the puberty, and there is any hormonal imbalance during the menopausal age, during the climatic period. Okay. Now the lachesis. The lachesis medicine is has a menses too short, too feeble, and all the menstrual pain is relieved by the flow. We can compare lachesis medicine with the UPO medicine. Okay. Both have the same symptoms, like a pain is relieved by the flow. Now, lachesis has a main action on the left side. Means, so the lachesis affect the left ovary. Left ovary is very painful, very swollen, and indurated. Menses is irregular and scanty. There is a pain worse before menses, and there is a pain relieved by the flow. We can give the lachesis medicine at the age of menopause. All the complaint of lachesis is left-sided. Oh. Lachesis is especially at the beginning of the menses, or there is a close of menstruation. There is a swollen of the left ovary, indurated, painful. Patient must lift covers. Means during dysmenorrhea, uh, uh, patient is not tolerate even the bed clothes. He has he has to lift all the bed clothes during the painful menses. So, menses is black, scanty, lumpy, acrid, and vicarious from nose. Means instead of menses during the time of menstruation, there is a bleeding from the nose instead of menses. In the cases of lachesis. Okay. uterine and ovarian pains is better by the flow of blood. There is ovarian tumors like a PCOD or any ovarian disease. Dysmenorrhea on the first day, patient has to desire to go into opponent and run about before the menses. Now, ailments from uterine and ovarian congestion, ailments from jealousy, ailments from chronic ovarian disease. Phosphorus. Okay. Phosphorus has a menses too frequent and prolonged menses which there is a bright red building. Patient is very tall, sensitive, very emotional, very sympathetic, and anemic patient. Menses is too early, scanty, but there is a no profuse bleeding, but there is a prolonged bleeding. Leukorrhea is profuse, smarting, corrosive, and there is a leukorrhea instead of menses. There is infertility, sterility from the excessive voluptuousness. Means there is infertility due to the excessive sexual desire, or there is infertility due to the late menses, or there is infertility due to the profuse menses. Okay. Frequent and profuse menses, or there is a short bleeding in between the period, especially in the nursing woman. Okay. Now, patient weep before the menses. There is a stitching pain in mammary gland during menses. Leukorrhea is profuse, smarting, corrosive, and instead of menses. Now, amenorrhea with vicarious menstruation. We can compare phosphorus with the bryonia. In the cases of bryonia, as we all know, there is a nose bleeding at the time of menses. There is a nose bleeding instead of menses. In the cases of phosphorus, uh, there is a vicarious menstruation. There is a instead of menses, there is a nose bleeding. With there is a bleeding from the bleeding in the cup. Hemoptysis is there or hematemesis is there instead of menses in cases of phosphorus. But in cases of bryonia, there is a only nose bleeding instead of menses. Okay. Now the ailments from. Phosphorus has ailments from after the overexcitability, uh, hemorrhagic tendency, ailments from hemorrhagic tendency, ailments from anemia, ailments from any anxiety, any any emotional disturbances. Okay. Now the sabina. In the cases of sabina, there is a menses is too profuse, too early, gushing of hot, bright red blood with there is a watery blood. Blood is mixed with dark clot and bleeding is worse from the least motion, but it is often better by the normal walking. With pain in the menses, with pain in the joints, there is a pain. This one is the characteristic symptoms of the sabina. Pain from sacrum to pubis or reverse means there is a pain from pubis to sacrum. There is a shooting up pain in the vagina. Bleeding in between the pillars, there is a sexual excitement with menses. Leukorrhea is foul, acrid, thick, yellow, and leukorrhea from suppressed menses. Or there is a copious menses. There is a severe itching in pudenda, and there is a uh, itching during pregnancy, or there is a bleeding during pregnancy. Okay. Leukorrhea. Leukorrhea is after menses is very corrosive and offensive, profuse bad red bleeding and clots with pain from sacrum to pubis. This one is the characteristic symptoms of the sabina. Okay. Ailments from endometritis, ailments from ovarian irritation, uterine fibroid and endometrial polyp. Now the trillium. Okay. Trillium has a uterine hemorrhage with sensation as through hip and back is falling into the multiple pieces. Patient has a better from tight bandages. This one is also the characteristic symptoms of the trillium. Uh, Gushing of bright blood on the least movement. There is a hemorrhage from fibroid. There is a faintness and sinking at the stomach during the menses. There is a menses every 2 weeks, means there is a hypomenorrhea. There is a profuse gushing bleeding, weakness in the hip and the back. Elvenstrom. Trillium patient has a Elvenstrom after the childbirth and Elvenstrom after the physical exertion. Okay. Now the Ferrum There is a profuse menses with anemia. Menses is pale, watery, menses too early, too profuse and protracted, prolonged flow during menses. Intermittent menses with labor-like pain. There is a leukorrhea which is milky, acrid, watery at the time of puberty. Menses is remittent a day or a 2 day and then return. Discharges of long pieces of from uterus. It is indicated especially in the woman who is very weak, delicate, and chlorotic, means there is a anemia. A patient have a fiery red face, means it is too early, profuse, and too long lasting, with there is a watery and there is a sensitiveness in the vagina during the menstruation. Okay. Patient has a albans from anemia. Okay. Now I will share one cases of irregular menses with you. There is a one girl, one female, about 20-year female, having a complaint of fever and hot body after the NEET exam. Means there is a continuous feverish feeling and hot body after she giving exam NEET exam. There is a spotting continuous for 1 month after he is taking allopathic treatment for fever and hot body. But after 1 month there is a regular menses. But after that menses become irregular. Means first the patient have a complaint of fever and hot body. For that she taking allopathic medicines. But after taking allopathic medicines there is a spotting continuous for 1 month, but after this 1 month, patient has a regular menses. But after the some periods, patient also after the same period, there is irregular menses. Okay, present complaint is the irregular menses. Menses is late and delay. Last menstrual period was 24 July 2025. Menses irregular. Okay. Physical gender. Appetite is normal. Thirst is 2 to 2.5 liter per day. Patient is very chilly. Stool normal, urine normal. There is an excessive desire for sweet. Desire for sweet plus 2 marks. Okay. Past history of breast abscess, recurrent style, and dysentery. Family history of asthma. Maternal grandfather has asthma. Paternal grandfather has a pious and renal stone, and sister has a eczema, and brother has a mental retardation. Okay, now the mental gender. She is very ambitious, uh, very sincere, very ambitious, but there is a lack of self-confidence. She has to someone who constant motivate her. There is a fear of ghost, fear of being alone. She is very sensitive to criticism and very sensitive to rudeness. There is a history of unhappy childhood. Means his paternal grandfather hit her brother daily with the sticks. There is ailments from loss of ambition. I taken ailments from because in earlier slide we discussed that uh, she she developed irregular menses after the NEET exam because his exam is going very poor. She getting very less mark in NEET and does not getting admission in MBBS. She get admission in the BHMS. Okay. Person is very ambitious, very sincere, and she is very time punctual. Okay. There is a lots of pressure on her related to education. His paternal grandfather, great grandmother, great grandfather, and his parents constantly pressure on her for education. They tell that you have to take admission in the MBBS. you have to take in the admission in the MBBS, you have to study lots. In the childhood, his mother left her with her paternal grandmother at the age of 6 months. I have had taken rubrics of mind ambition increase because he is very ambitious, and his future goal is that he has to clear his MD. He will being he will in the future he will become a professor in any homeopathic college. There is a mind ambition loss of mind anxiety time is set as it because he is very punctual, time punctual. There is a mind confidence want of self because there is a very poor self confidence. Mind fear of ghost and mind sensitive to criticism. I given her carcinosin 201 dose because these all rubrics are covered by the carcinosin, and there is a history of family history of asthma, family history of mental retardation of brother, and there is a lot of parental domination in the childhood, in recent, and she is very ambitious and she is very nature lover. Okay. Now the follow up. Menses, okay. First menses is last LMP was 24th July 2025. After the giving carcinosin 201 dose, there is a menses again appear on the 22 August 2025. I had given his seclec on the 18th August. Next month, there is a menses come on the 21st September 25. And next given seclec again on the 23rd September. After the September, there is a no menses appear in the October. So I again give her carcinosin 200. After the giving dose, there is a menses appear on the 7th November 2025. This time the menses is delayed. After that, he has complained of throat burning with abdominal pain and constipation since 3 to 4 days. It's just an indisposition. So I given her Seclec. Okay. Now in the December there is a menstruation is appear on the 6th December 2025. Okay. After recent, there is a headache due to the ailments from the sleep disturbances, and there is a exam. So he has a anxiety about the exam, and there is a sleep disturbances. So I given her Naxvomika 1M 1 dose, and after that, she has a menstruation appear on the 9th January 2026. Okay, my presentation is complete. Sir, anyone have any questions?
Yes, Dr. NAMRATA Trivedi, it's really a very good session. You covered almost every part of this irregular menstruation and profuse menstruation and why these things happen, etiology, pathology. So everything was discussed in a beautiful way. And you have suggested some of the best medicine for that also. You can stop, we can stop screen sharing first, and then can you, so that we can see who are the participants interested in talking, and
Okay, sir.
could you share your yes, you can share the number also. Somebody want to, it is there in the poster already. We have given it. Yes, yes, we have given the number in the poster. Otherwise, you can once again write it down on the chat box so that everybody can reach you. And we all know that this is a condition which really troubles most of the ladies, and particularly in girls, because everybody is in a rush to do things in a hurry manner. And there were a lot of stress coming in between, whether they are the students or wife or the housewife or even grand uh, people, because even people have menses up to 45 to 51 years, 50 to 55 years sometimes. Even during menses, from the menarche to menopause, we may have ladies may face this kind of things. Actually, you can have it can happen at any time in their lifetime, and uh, I think you have missed the medicine sepia here. Whether you mention sepia is one of the most important remedy for medicine for this kind, because all kind of bleeding can be controlled. The mind of a person in different situation also quite common with the sepia ladies. Have you mentioned the sepia here? I thought that
Yes.
you missed it or not?
Sir, I had mentioned sepia.
Oh, okay, okay. I just because in between there, but yes. Yes, API is a wonderful remedy. Then another medicine that could be used here. We know that the color of menses will also indicate some medicine specifically. For example, if it is a bright red, we can think of millefolium, and that will be a very good remedy.
Yes, sir.
And
It's
if it is of black, then we can think of hamamelis, because
yes,
those ladies
Namratas.
who are having this varicosity in their legs, along with this kind of gregarious menstruation, then we can think of hamamelis in those conditions also. And sometimes these kind of things may happen because of fibroids also. In those conditions, fraxinus may be of good use. Fraxinus tincture will work wonderfully. And another remedy I would like to add here is calcarea force is a very beautiful. Yes, because calcarea, both the calcarea as well as phosphorus, both are having correlation here. But it is a very and ferromate you have mentioned, and ferrophos also can do some kind of help uh, in these kind of conditions. And your case presentation was also really good, because I don't know why you just directly. Usually, people may think that it is a female condition, so we will have to think of some melancholic remedies for
Yes.
that. But instead of that, as just like any new generation doctor, you also choose this carcinosin. But frankly, carcinosin is quite common nowadays, because if you repertorize a case, you may come up with or end up with the carcinosin. Let me ask the question. What was the face of that? What kind of face the person has?
What kind of face?
Yes, the expression. I mean that your face is somewhat round, and my face is a little bit long, elongated. So, what kind of face it was?
Patient
Yeah.
face is,
Actually,
huh? Yes,
yes,
yes.
yes. Do you remember? Let me come to that. Uh, you may not be able to remember. Actually, if the person is a carcinosin, the face itself will be a round shape or a moon shape. That's what we will have to think of. But if it is a tubercular patient, tuberculum and carcinosin are somewhat similar in most of things, most of the aspect. They are both are having problem with the parents and the family, as well as they are also both are troublesome. They are having a lot of common things in, but yeah, the face itself a little bit elongated in tuberculinum, but it is a moon phase that we can say that it's a moon phase, like that. So these are the things one need to be considered. But actually, if in the same case, if Netromor, Agnesia, all those sepia, all those can be considered, but it is up to the doctor to decide whether we have to give carcinosin. Anyway, you got result from carcinosin, but
Yes, sir. Yes, yes,
But
yes.
after that, at last you give Naxomica. That's a very contradictory drug here because
Sir,
sleepless. If you can just give some Califos or some other medicine for that. I think.
given Netramir on the base,
Yeah.
Naxomic on the basis of uh, there is a ailments from disturbances causes headache, and there is some kind of constipation.
Yes, yes, that also is there in Netamor. We know that and Netamor patients are, most of the Netamor patients are having a problem in the anus, and because of the stress, the physiological aspect of this phenomena of evacuation is the dilatation of the rectum. Because since most of the persons who are in mental stress have this inability to dilate the rectum. So that may result in constipation, and there will be pain also. In those conditions, Netamol is a wonderful remedy, the first grade remedy for that. So those who are having, so we can also think about, we used to say that one of the best remedy for menses, there are people who are having pain before menses or severe pain, uh, uh, pain as well as vomiting, diarrhea. So we used to say that diarrhea-like symptoms at the commencement of menses. You may be
Ah,
remember the
ammonia.
medicine. Yes,
Yes,
ammonium carb.
ammonium carb. Yes.
Yeah. But people may think that, oh, I can give also, but ammonium carb, if you give ammonium carb, that will work wonderfully like that. Oh, anyway, it is the time for discussion, and anybody want to speak to Dr. NAMRATA Trivedi, young dynamic doctor from North India, from uh, Gujarat. Uh, so you can raise your hand and we can have a discussion. Please, how it is. There are, can you see what is a number of people?
Have you arrived carcinosin by repetition? Uh,
Right. Yes, yes, that was a question. And you're right.
uh,
Oh, yes,
I uh, I had given I had taken rubrics.
yes.
After that, there is a 3 to 4 medicine like a phosphorus, natrium, sulfur, and carcinosin are in the repetition. But I had read carcinosin from many books like a Phobistal book, like Boric, like Murphy, like Fatak. In the carcinosin, there is a history of asthma or cancer must be there, or there is a history of mental retardation, and there is any history of parental domination, suppression emotions. On the basis of that, I have given her carcinosin 200.
Yes, doctor. Can you please write down your the number in the chat box so that somebody want to contact you? Of course, you can give.
Yes, sir.
Yes. So the explanation is quite. I'm inviting Dr. Ambaresh sir to say a few words on the presentation of Dr. NAMRATA Trivedi. We will have to encourage these kind of young dynamic doctors so that they are the future of, they are, you can say, they are the future of homeopathy.
Yes, sir.
You can definitely, yes, sir.
Thank you, Dr. Dhaneji and Dr. Saila, and congratulations, Dr. Navta.
Thank you, sir.
Very nice, excellent presentation. Female disorder, irregular menstruation, very nice. It is hormonal disbalance. Hormonal disbalance, cause of irregular menstruation. Hormonal means electrical disbalance. Electrical disbalance after hormonal disbalance. Hormonal disbalance is invisible disease and physical, mental, any types of disease. So very, very thanks, Dr. Naroda.
Thank you,
Really,
sir.
thank you. Very nice.
Doctor, what What is your experience in the college? Whether you people having a very good OP there in the hospital, or just what
Uh,
about your college, homeopathy, homeopathy medical college?
uh, College is very nice, but I had a lot of experience from I had doing MD from Ahmedabad Homeopathic Medical College.
Yes.
Since that time, uh, I see the patient from my clinic and also from Ahmedabad Homeopathic Medical College. So since 2 years, I seen the patient and giving homeopathic medicines. And between them, I am the assistant doctor at Dr. Nirav Bhatt Clinic at Ahmedabad,
Okay.
nephew of Dr. Bhaskar Bhatt.
No, no,
I
doctor.
think.
What I want to know is that what kind of OP in your hospital, or whether you people are getting lot of cases in your OP, or
Yes,
what kind of,
there is.
whether what about your IP admission in the hospital, in the medical college hospital? How many patients are being admitted in the hospital for homeopathic treatment?
Yes, in Ahmedabad Homeopathic Medical College and in Elasa Homeopathic College, there is lots of patient.
But
We,
now you're working in the different college, LH homeopathic medical college.
at the Elasa Homeopathic College, there is a lots of patient in OPD
Uh,
for
what about
taking
the
homeopathic
IP?
treatment.
What about the IP?
Huh, sir?
What about the IP? That means inpatient admission. How many
Yes,
being admitted in your in the hospital?
yes,
Yes.
there is IPD. There is a patient in
And
IPD at Elasa Homeopathic College.
Is there any kind of research work undertook by you in the hospital?
Yes,
Whether you people are getting, the students are getting any remuneration for this kind of things?
yes. Student having a regular OPD duty of student
Yes,
of
whether
all years.
they will be given a remuneration for that.
Huh, sir? Can't understand your questions.
Whether the students working in the hospital get any money from the government or not.
Yes,
So
in the
what
intensive.
whether in the internship time, how much rupees are people are getting as say honorary, like
I think it's different
college to
from different
college,
college
not
to college
say
different.
not saying in all colleges. There is no government no for that. The government is not giving money for that. Because we would like to know everything, because we will have to rectify all these things. We will have to give a memorandum to each and every government, so that the students getting shall get some high remuneration for all these things.
Yes.
And now I invite Dr. Sheila to say auto thanks to Dr. NAMRATA TRIVEDI. Yes, Dr. Sheila, you
Uh,
can say auto.
Thank you, sir. Good evening, all. The presentation was very nice, ma'am. You described very well, and you almost cover all the homeopathic medicines also with their symptoms. It was a very nice presentation, ma'am. Once again, come to the platform again and share some your experiences. Thank you so much. On behalf of IFPH, I once again thank you all for this good session, sir. Thank you.
Thank you, ma'am.
Thank you, Dr. Singha, Dr. NAMRATA Trivedi, Dr. Rambaresh sir, and those who attend the session this evening. And tomorrow we will have a session from Dr. Prakash Rao, and Dr. will be talking about the proof spreading and its homeopathic management. It's a very, very important subject and very recent subject. Everybody, what kind of attitude every homeopath need to look into, because we know that it was the time of COVID. There was no treatment for viral diseases according to allopathy people, but we have homeopathic treatment and we have done it in a style also. Thank you all. Good night. Hope all of you will be joining tomorrow at the same time. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.